This is Akashvani. In the program Spotlight, now we bring you an exclusive interview with Apurva Chandra, Secretary, Ministry of Health and Family Welfare on National STOP Diarrhea Campaign 2024. The interviewer is Aditya Shukla, Akashvani correspondent.
Union Health Minister J.P. Nadda had launched the National STOP Diarrhea Campaign on June 24th. In his address, he said,
"We are starting this Stop Diarrhea campaign in 2024. But I would like to make you remember also that there is a unique relationship between this rotavirus diarrhea Indradhanush program with me and Anupriya. Because in 2014, it was one of the first programs which we had launched. And after coming to the government, this is again the first program that we are launching. Coincidence, but yes, certainly. In 2014, we started Mission Indradhanush. And it was in 2014 that we introduced rotavirus. At that point of time, as I remember, that in Southeast Asia region, India was the first to introduce rotavirus. And then we re-intensified in 2016. That was done by Honorable Prime Minister in Vadnagar. And after that, if I remember, it was scaled up in 2019. And now in 2014, we are again scaling up the duration of the campaign from a fortnight to 2 months. I must congratulate the Health Ministry for doing so and thinking about it so that and giving a priority to this area.
the aim of the Stop Diarrhea Campaign 2024 is to prevent diarrhea and reduce child mortality. In this program, we will be discussing the objectives, strategies and importance of this campaign. We have with us Secretary, Ministry of Health and Family Welfare, Shri Apurva Chandra ji. Welcome in the program, sir.
Thank you.
What are the objectives of the National Stop Diarrhea Campaign 2024 and how is it different and special from previous campaigns on diarrhea prevention?
The main objective of the Stop Diarrhea campaign this year is that this time it is a 2-month campaign, unlike the previous years where it was a 15-day campaign. And this time we are placing 2 ORS sachets at each household where there is a below 5 child and also 14 zinc tablets. Earlier it used to be 1 ORS sachet. So we hope that this will make a major change in the outcomes. And this is being a 2-month campaign, it will cover the entire monsoon period, which is the period in which most of such diarrhea cases come up because of the contaminated water. So we hope that this will lead to good results, and this time all the states are also taking it up very keenly. And because diarrhea is an area where almost 50,000 children below 5, they lose their lives every year, and we feel that this is an area which can be controlled by taking due precautions.
As I remember, the Ministry of Health had launched the 15-day special campaign. How will this campaign help achieve the goals of that program more quickly?
So it is a question of not more quickly but more effectively. Because in the earlier campaign it was a 15-day campaign which would not cover the entire monsoon period. Then there was only 1 ORS sachet which was given. And the objective of 2 ORS sachets is that in case a child is having some sort of a loose motions and some sort of infection, then the mother can take care of the child, can use the ORS sachets because they are available with her, and that will take care of the child for about 48 hours or so. And if the condition of the child does not improve, then the mother can take the child to the nearest PHC or for further medical help, and can also report to the ASHA workers and others who will facilitate her. So that is, with that being the objective, and the availability of the ORS sachets which are being distributed in very large numbers this time, and funds are also being made available to all the states under the National Health Mission to procure these zinc tablets and ORS sachets and make them available. So we hope that this time the results will be much better than the previous year.
As you said, this campaign prioritizes the goal of zero child deaths. Can you tell us how serious a problem diarrhea-related child mortality is in India and how campaigns like this can help control it?
So about 5.8% of the deaths of children below 5 years are attributed to diarrhea, which is a very substantial amount, and as I said, more than 50,000 children lose their lives to diarrhea. Of course, this data dates back to about 2019-20. Now with the piped water supply also coming in many parts of the country, and we are now going through the NFHS 6, so The numbers should have come down. As we get more statistics, we'll get to know, because it is directly related to the quality of water which is being supplied. But many a times during monsoons, because the quality of water becomes poor and contaminated water, that leads to this. So that is why this campaign is launched during the monsoon, the pre-monsoon, when we make the preparatory activities. So all that is being done, and we hope that this will show good results, and then this 2-month campaign will become a continuous feature in our fight against diarrhea for the years ahead.
The campaign is divided into two phases, preparation and implementation. Please elaborate on these phases and the activities included in them.
So in the preparation phase, which was a 15-day phase between 15 June and 1st of July, and that time the listing of all the households and taking all these material to them, then all the IEC campaign which was launched, we have prepared all the material for information and education, and that has been done in English, Hindi, and also in 12 languages. It has been shared with all the states. So the states will in turn share it to the districts and to the Anganwadis and the sub-centers. And also, because in this 6 departments of the government of India are involved, so it is not just a campaign which is of Ministry of Health. In fact, the 6 secretaries of government of India wrote a letter to the state governments. For example, the departments which are involved are rural development, urban development, then drinking water supply, health, of course, and so many departments they have been writing to the, and all their field level functionaries are also getting motivated and becoming a part of this campaign. So we hope that this convergence of all the departments at the central level, at the state level, will lead to better results and outcomes.
And of course, people's participation will also be an important aspect of this. So what are preparations that are in place to take this campaign to the grassroots level?
As I mentioned, because the workers of all the departments, whether it is rural development, whether it is drinking water supply, whether it is health, whether it is Panchayati Raj, whether it is urban development, all of them are involved at the central level, at the state level also. So, for example, in our IEC activities, we have held VCs with all the concerned, and then in turn they have held at the district level. Then the ANMs, they have been trained, the ASHA workers have been trained, and they are making field visits to the houses. Below 5 children are there, which is all, the list is there with the on the RCH with each sub-center. So physical visits are being made, and these 2 sachets of ORS packets and then the zinc tablets are being provided, and then a continuous follow-up will also be maintained in case there is any complaint or anything.
As you already mentioned, Asha's role would be very important in this campaign. So also the ORS and zinc tablets that would be distributed to the households will also play an important role. So what significance does awareness play in preventing diarrhea?
So diarrhea is a preventable disease in the sense that the mother has to take precaution. The role of the mother is of course very important. They have to take precaution that the child does not consume any contaminated water, and that is why the information and booklets, they are also very important, that what are the precautions which the mother has to take, in what way the mother has to protect the child, and hygiene, then hygiene is also very important. So all those factors are a part of this. Videos have been developed, information material has been developed, and all of that is being played out on the social media apart from the other channels, and the states are also doing the bit in this regard.
And Swachh Bharat Mission, of course, will...
Yes, that is what I said, because this data also is 2019-20, and NFHS 6, I am sure when data comes out next year will show better results. But of course, this campaign is also part of that. But pipe water supply definitely would have made things different over the past 5 years.
This campaign focuses on various aspects like health infrastructure, sanitation, and nutrition to reduce child mortality and prevent diarrhea. How can this campaign become a model for better healthcare services and community participation in the country?
See, this campaign is based on, first of all, it is a convergence of all the departments. Various departments are working at the field level. So it arises from this that no department on its own can achieve the ultimate objectives, and we have to all work together with the objective of providing good health to the people. So whether it is Anganwadi worker, because the child goes to the Anganwadi also for a large part of the day, below 5 child, and then stays in the house. And everywhere the kind of training, the kind of education which the child receives, apart from the child also has to learn that these are the things which lead to good outcomes, that these things should be avoided. So that also training through the Anganwadi. Then ASHA workers again telling the mother, then the rural development department, the drinking water department, because they have to ensure that the pipe water supply, the pipe water supply reaching the households, urban development department, they have to see in the urban areas. So all those things, they have to converge together. And at the state level also, because these are government of India departments, at the state level also, because everybody has to think together. work
Yes.
together.
So convergence is a major point here. So how is this campaign being supported by ministry campaigns, schemes like Mission Indradhanush and NHM?
National Health Mission, so of course, this is because this is Ministry of Health only, and this the entire funding of this campaign, like the 2 ORS packets and the zinc tablets, that is part of the NHM, and the IEC material has also been developed by the NHM, and that has been distributed to all the states, and it is led by the National Health Mission with the support of all the other departments. And Mission in the Dhanush, which is basically the vaccination part, so that also plays a role in this because I mean the ASHA workers, they keep a contact with all the households, and they are in touch with all the households. So where the ASHA workers are in touch with the household, where they know the health of the child, then definitely the outcomes will be better. And ASHA are really the flag bearers of all health campaigns, and they are the real workers who have been providing primary health in our country.
They are the backbone of the
Yeah,
health
they are the
infrastructure in
backbone.
India. Yes. How is the ministry coordinating with other ministries and departments to implement this campaign?
So as I mentioned that we have had joint meetings. We have had in the VC also, when we held a VC with the state governments, and the other ministries also participated. They say their thing to their concerned departments. They also hold their VCs with their counterparts in their states, and the ministers in the concerned departments, they are also reviewing this campaign. The chief ministers at the state level, they are launching and reviewing their campaign. So once the chief minister is involved, then all the departments in the state, they start converging, and everything, it acquires seriousness at the state level.
And also states participation is an important aspect. So how the ministry is ensuring the participation from states, because we must know that it is a concurrently subject. So how is the ministry ensuring the robust participation from the states?
Ministry provides the wherewithal. Through the National Health Mission, we have provided the ORS packets and the zinc tablets, and also the IC material. We have asked the states, but then states themselves are very motivated. They are highly motivated as citizens of India residing in a particular state, and the state is also keen in the welfare of their children, whosoever are the children. So all the states are very much on board, and they are very keen. In fact, a lot of states have, as I mentioned, have launched the programs through their chief ministers, and all of them are very keen to work on this. And for them also, this is new, that this time this is a 2-month campaign instead of 15-day campaign. They would also like their children to fare well in life. Diarrhea is a preventable disease, and the objective of the Stop Diarrhea campaign is that the mothers and the women and all those in the household, they can take proper measures to prevent diarrhea happening to children who are the most vulnerable, below 5 age group children. All the campaign material, all the information is available with the ASHA workers, with all the workers at the ground level, Anganwadi workers and all the others. So it is my humble request to all the mothers of this country to take care of their children, to take simple precautions like hand washing, using proper water, and in case that a child does get some loose motions, then inform the ASHA worker, use the ORS packets which are given, but even then if the condition does not improve, then inform the ASHA worker, take the child for further treatment.
As we discussed, the campaign's focus on awareness, sanitation and nutrition is crucial in preventing diarrhea and reducing health mortality. Thank you, sir, for sharing valuable insights with us. Thank you so much.
You were listening to an exclusive interview with Apurva Chandra, Secretary, Ministry of Health and Family Welfare, on National STOP Diarrhea Campaign 2024. The interviewer was Aditya Shukla, Akashvani correspondent. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsttalks@gmail.com or WhatsApp on 9289094044.